Keep watching to see additional important safety information at the end of this video.
I'm Kayla.
And I'm Valerie.
We met on a job a couple years ago and we instantly connected.
Yes, and now we are roommates and we like to have lots of fun together on the daily. So I actually have many friends who have gotten Botox cosmetic treatments.
And I've seen a lot of information online with like stories, videos, and of course BotoxCosmetic.com.
So now we're looking into getting Botox cosmetic.
It feels like now we should find out if it's right for us.
Valerie and Kayla heard about the Look of 3, a Botox cosmetic treatment of 3 areas, 64 units, at least 3 times a year. If your specialist thinks it's right for you, you could get the look you're looking for. Only Botox Cosmetic is FDA approved to temporarily improve the look of 3 areas together: moderate to severe frown lines, crow's feet lines, and forehead lines in adults.
So now we have our Botox cosmetic plan in place.
Yes, we got an assessment from our specialist and he explained that we're appropriate for having 3 areas treated simultaneously.
We found out that Botox Cosmetic is the only product of its kind that is actually FDA approved to treat 3 areas together. So we like that there's a balance, as our specialist explained. Everyone's different, so your specialist can advise you on what's right for you.
It's called the Look of 3.
We're down for that.
Before we start, I need to let you know that there are risks associated with this product.
Okay.
Its effects may spread hours to weeks after the injections, which can cause serious symptoms.
Okay.
Yeah, so it's been a month since we've gotten our Botox cosmetic treatments.
And the treatments that day I felt went really quickly and we have been loving our results.
Yeah, I mean, now that I really see what Botox Cosmetic does, I'm so happy. You know, my moderate to severe frown lines, crow's feet, and forehead lines are noticeably smoother, even though it is temporary. And we went back for a follow-up with our doctor and he said that he was happy with the results so far.
Yes, and so are we.
And so are we.
But you know how I am. I always overthink everything.
What? No. Yes, I'm very familiar with that trait of yours.
Thank you. So I just visited BotoxCosmetic.com just to look around, and I actually read that Botox Cosmetic is manufactured in a unique way, and there's literally nothing else like it.
Yeah, I was really happy that our doctor chose Botox Cosmetic because, like we've been saying, it's the only product of its kind that's approved to treat 3 areas together.
And that's actually really important because all of the muscles are interrelated and they all work together.
Yeah, and I'm really excited to go back for my next appointment and be reassessed for our next treatment.
I can't wait. And in the meantime, one side benefit is rewards.
Yes, rewards.
So we actually joined Ally, the Allergan Aesthetics Loyalty Program, which means every time you get treated with Botox Cosmetic, you get points in your wallet.
Yeah, it's discounts to use towards future Botox cosmetic treatments.
Speaking of, we are actually hoping for 3 Botox cosmetic treatments this year, but we'll see what our doctor says.
Yeah, but in the meantime, we are super happy with our experience and our results. I mean, look at her.
Look at us. Just
Look at us.
Approved uses. Botox Cosmetic is a prescription medicine that is injected into muscles and used to temporarily improve the look of moderate to severe forehead lines, crow's feet lines, and frown lines between the eyebrows in adults. Important safety information. Botox Cosmetic may cause serious side effects that can be life-threatening. Get medical help right away if you have any of these problems anytime, hours to weeks after injection of Botox Cosmetic. Problems swallowing, speaking, or breathing due to weakening of associated muscles can be severe and result in loss of life. You are at the highest risk if these problems are pre-existing before injection. Swallowing problems may last for several months. Spread of toxin effects. The effect of botulinum toxin may affect areas away from the injection site and cause serious symptoms including loss of strength and all-over muscle weakness, double vision, blurred vision and drooping eyelids, hoarseness or change or loss of voice, trouble saying words clearly, loss of bladder control, trouble breathing, and trouble swallowing. Botox Cosmetic dosing units are not the same as or comparable to any other botulinum toxin product. There has not been a confirmed serious case of spread of toxin effect when Botox Cosmetic has been used at the recommended dose to treat frown lines, crow's feet lines, and/or forehead lines. Botox Cosmetic may cause loss of strength or general muscle weakness, vision problems, or dizziness within hours to weeks of taking Botox Cosmetic. If this happens, do not drive a car, operate machinery, or do other dangerous activities. Serious and/or immediate allergic reactions have been reported. They include itching, rash, red itchy welts, wheezing, asthma symptoms, or dizziness or feeling faint. Get medical help right away if you are wheezing or have asthma symptoms, or if you become dizzy or faint. Do not receive Botox Cosmetic if you are allergic to any of the ingredients in Botox Cosmetic. See medication guide for ingredients. Had an allergic reaction to any other botulinum toxin product, such as Myobloc, Rimabotulinum toxin B, Dysport, Abobotulinum toxin A, or Xeomin, Incobotulinum toxin A. Have a skin infection at the planned injection site. Tell your doctor about all your muscle or nerve conditions, such as ALS or Lou Gehrig's disease, myasthenia gravis, or Lambert-Eaton syndrome, as you may be at increased risk of serious side effects, including difficulty swallowing and difficulty breathing from typical doses of Botox Cosmetic. Tell your doctor about all your medical conditions, including plans to have surgery, had surgery on your face, have trouble raising your eyebrows, drooping eyelids, any other abnormal facial change, are pregnant or plan to become pregnant. It is not known if Botox Cosmetic can harm your unborn baby, are breastfeeding or plan to. It is not known if Botox Cosmetic passes into breast milk. Tell your doctor about all the medicines you take, including prescription and over-the-counter medicines, vitamins, and herbal supplements. Using Botox Cosmetic with certain other medicines may cause serious side effects. Do not start any new medicines until you have told your doctor that you have received Botox Cosmetic in the past. Tell your doctor if you have received any other botulinum toxin product in the last 4 months, have received injections of botulinum toxin, such as Myobloc, Dysport, or Xeomin in the past. Tell your doctor exactly which product you received. Have recently received an antibiotic by injection. Take muscle relaxants. Take an allergy or cold medicine. Take a sleep medicine. Take aspirin-like products or blood thinners. Other side effects of Botox Cosmetic include dry mouth, discomfort or pain at the injection site, tiredness, headache, neck pain, and eye problems, double vision, blurred vision, decreased eyesight, drooping eyelids and eyebrows, swelling of your eyelids, and dry eyes. For more information, refer to the medication guide or talk with your doctor. To report a side effect, please call Allergan at 1-800-678-1605. Please see Botox Cosmetic full product information, including boxed warning and medication guide.